everyone. Welcome to this episode of the Entrepreneur Showcase Series brought to you by Patranya Media LLC and Parkway Media Partners. I'm your host, Patranya Poonswan, and our guest in the studio today is Dr. Christopher Choi, the founder of Concierge Wellness Center right here in Las Vegas. Welcome to the show.
Thank you very much for having me.
Thank you so much for being here. And you have a great practice here in Las Vegas. So we're going to talk a little bit about that because this is actually a field that I think a lot of people are paying attention to, and it's really growing, especially here in Southern Nevada. So Dr. Christopher Choi, again, Concierge Wellness Center. You started the center how long ago now here in Las Vegas?
Well, I've been in Vegas for 22 years and then converted to a Concierge Wellness Center, which is a concierge style of primary care in 2008.
Okay. So you started basically as a primary care practice, and back in 2008. So concierge, does that mean you go to places wherever people are, or do they come to you? How did it work then?
Well, mainly patients will come to the office because we have all of the equipments, we got staff there, so the care can be delivered better if the patients come to the clinic.
Got it.
So in 2000, I was just a regular primary care clinic, and then because of the medical economics, I knew I wouldn't be able to keep the clinic open.
Right.
So we had to make some changes. So in 2008, we converted officially to a concierge style of practice.
So like a true entrepreneur, right? You have to kind of adjust and be flexible with the time. So at the time you saw that just operating as just a general primary care, you had to expand it a little bit. And how did that change come about? How did that transition kind of affected your practice?
It was very nerve-wracking. Whenever there's a change, physicians really don't like changes.
Yeah.
We are good at what we do because we like to do things exactly the same way every day.
Yeah,
all
it's
day.
predictable.
Yes, predictable,
Yeah.
Predictability.
Yeah.
So every time we make changes, this is why we're not very good business people, because we're good at what we do, seeing patients, treating patients, but we're just not good at business. But, I knew that if I did not make this change, I would not be able to survive from business standpoint. So, and honestly, I was providing concierge style of service to my patients even before. I answered my phone calls at 2 in the morning, even back in 2000. And so on. So a patient got in to see me the same day or the next day. But I wasn't going to be able to provide that level of service unless I switched. So in 2008, that's when I switched, and and the practice continued to grow. Word of mouth, and continued to grow, and it just became very popular. And as of about 7 years ago, we have really not been able to take any new patients, and hence we went on search and found another physician to join us last.
And it's great to hear. I mean, and I think that's really interesting. I haven't had many medical professionals in here. I think it's great to hear your story, especially as, a medical business. I mean, it is a business, and you want to make sure that you grow and be sustainable. And we're going to talk about your aesthetics medicine field too, because you've really kind of put that into the forefront, and a lot of people are now coming to you for that. So we're going to talk more in details about that, and you're adding another physician, which is great to hear. But your background, really, you were in academics for a long time.
Well, actually, when I was in LA, I finished my training and then did my chief residency, and I was in academics for a very short time.
Oh, just a short time.
Very short time at UCLA, St. Mary's, which was part of the UCLA system. But then I figured out very quickly that I'm not an academician.
Oh, okay.
I'm a clinician. I need to see patients.
That's your strength.
Yes, I need to engage with patients, so that's when I decided to move to Vegas, because I heard that Vegas was a haven for physicians, because we can come here, open up our practice, and the business will be good.
And there's a population here that needed that medical practice.
And the population was growing like crazy back in 2000. So that's when I moved to Vegas, and Vegas has been great. I mean, it just has been a great place for me, and I'm happy to and proud to call Vegas our home.
Yeah, and you've been recognized, and I know you were one of the top doctors as well, right? And we're here in Southern Nevada, so you've definitely done well for yourself. So it's great to hear your story, and I really want to hear more about how you changed, especially in the last 4 years when you brought this whole aesthetics medicine into the forefront. So talk to us about that.
So the way it began was, predominantly, I'm a internal medicine specialist and with the primary care. And our clients or our patients were asking, Dr. Choi, we would really come to your clinic to get everything done. Right now, we're going to other clinics to get our aesthetic procedures done. and so they're nagging me
Right,
for
right.
years. And so for several years, I kind of looked at the technologies, and about 4 years ago, I felt that the technology was there, and first, they're safe enough,
Right.
and they're effective enough. So basically, I pulled the trigger, and we started adding the aesthetic services. And over the last 4 years, we've added, and now we have a very full line of high-end non-surgical aesthetic services that we provide to our clients.
And I think that's what makes your business unique is you have the primary care on one side and you're really growing this aesthetic side of it. So talk to us, and you said, you have some high-end surgical equipment. Why is this so crucial to the work that you're doing right now?
Well, because, there are differences in devices and the safety.
Yeah, safety is key, right?
Obviously, if you want the device to be safe, you need to put a lot more research into it,
Right.
which makes the device a lot more
Efficient.
expensive.
Yeah,
Also
and
expensive.
it is
Yes,
expensive.
expensive. So that's why basically I have the Lamborghinis of the aesthetics devices.
Right.
Because I want to make sure that what we have is effective and also very, very safe.
Yeah, and what I think what you brought up, I think it's important, and even though we're talking about aesthetic side, it's still a medical procedure, right? So talk to us maybe about one of the procedures that you have. I think, is it called M-Face? Is that what it is?
Yes.
Okay.
That is the latest device that we added. It's by a company called the Body by BTL. It is extremely unique because it took about 6 years of clinical trials to bring this to public.
Yeah.
And what it does is it is basically a non-surgical facelift. It's actually very interesting. When you do plastic surgery facelift, you make an incision here.
Right.
And you actually pull the muscle. That's it's called the zygomaticus major muscle. And you pull that. And you cut, pull, tighten. And that's how you lift. Until now, there was no way to tighten the muscle without taking a knife to the face. But this new device called M-Face will actually create contractions in the face.
Without cutting anything on the face at all?
70,000 contractions in 20 minutes. But it does not hurt. But
Wow.
70,000 contractions, and it will tighten that same muscle. And so hence it will have the effect of lifting. And it also will lift the frontalis muscles. So you get an eyebrow lift. And it also has... So it combines two different energies.
And I know we have the pictures, and I want you to maybe
Yes.
talk to the pictures of our model here. And this is one of your patients, obviously, right? So talk to me about what she was, dealing with before, and then how that, just after 3 sessions, was able to change that.
So, we bought this to do non-surgical facelift for aesthetics. But again, the physicians are always looking to improve the process or improve the treatments for patients.
Right.
So this patient actually has Bell's palsy. So her right face is paralyzed.
Right side of the face is paralyzed. Okay.
Paralyzed. So we're thinking, hey, if we use this device to contract the muscles and stimulate, maybe we can actually improve the muscle function. And sure enough, after 3 sessions, she can actually open her right eye better.
Wow.
She can talk better. And she's also able to chew better. And you don't see the video, but I have a video in my clinic where she's able to smile, and the right side of the face will go up much better.
Wow. And
so
this
she's
is
very happy.
Non-surgical. So
Non-surgical.
is it what? Tell me, just kind of for people who are like me who don't understand it as well as you, what's the technology process that makes that happen?
Okay. So this is called a HIFS, high intensity focused electrical stimulation. So you apply a pad that will actually conduct electrical stimulation.
So it put electricity into your
Yes.
face, basically.
But it is specifically targeting that one muscle called the zygomaticus
So it's very
major
targeted.
muscles. Very
Okay.
targeted. So it will contract that muscle. So it will tighten, and it will increase the resting tension of that muscle by 30%.
Oh, wow.
And about 26% lifting effect.
And it doesn't hurt. You don't
Doesn't
feel any pain or anything at all.
No.
Wow.
That's the beauty of it.
Yeah.
And the second part is that it has a radio frequency with it. So radio frequency part will actually tighten the skin. and help with fine wrinkles.
Wow. So what I love about this is it's like you said, it's aesthetics, but it's also helping someone like your patient here who's dealt with this health issue for a long time.
Correct. So I would suspect that as time goes by, I know there is a clinical trial that just recently began looking at Bell's palsy with M-base. So we will have the data in probably next year or so.
Yeah.
I know that over a period of time, we are going to find more and more medical uses for these devices.
Yeah. So talk to me about some of the other procedures that you perform. I know we have some other pictures as well, especially when it comes to building muscles, right? And that obviously, as someone who's getting older and thinking about, hey, building muscles is important, but it's so hard to just do it at the gym. So, and you have patients of all ages who are coming to you for this procedure.
Correct.
Yeah.
And when I first got introduced to that device called the M-Sculpt Neo.
M-Sculpt Neo.
M-Sculpt Neo.
Neo.
And I actually thought, oh, excuse my French, baloney.
It's not going to work.
It's not going to work.
Yeah.
Until actually they put me on the device and
did it on you?
Yes.
Oh, wow.
Oh, wow.
Yeah.
And then they showed me the clinical trials that they did.
Yeah.
And it was impressive. They actually did MRIs before and after the treatments, and that's how they got the FDA clearance for building muscles.
Wow.
They were able to demonstrate 25% muscle growth and a 30% fat reduction on the abdomen across the board for all of the participants.
And we're seeing the picture here of the before and after. And you said it's even more visible on the side, right? So you can see the inches actually just down and from this patient. And is this non-surgical as well?
Oh,
or
it is
surgical?
Absolutely non-surgical.
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 Okay.
So she actually had a waist size of about 34 inches. Now, you cannot really see very well in this picture because it's two-dimensional, but her waist went down to 30 inches.
Oh, wow.
She measured it
After
herself.
1 month, which is four sessions. Four sessions. Oh, wow.
30 minutes,
Yeah.
not painful. And this is equivalent to doing 20,000 sit-ups in 30 minutes. Each session is like 20,000 sit-ups. And so she did 4 sessions. And if you look at from the side, her profile, you will actually be able to tell it's much flatter, her abdomen.
Wow.
Yeah,
and so tell me this is what's really interesting is that you can come in and do something like this with you. But what do you tell your patients? Obviously, their lifestyle matters. What they eat, how they exercise, all those things are critical to keep this a permanent thing, right?
Oh, absolutely.
Yeah.
So I tell my patients, look, if you're not exercising, if you're not eating healthy, these procedures are probably not going to be as effective.
Right.
So this patient exercises on a regular basis and she is really healthy.
Right.
And so she's been doing that all along, but just couldn't get rid of this. So that's why she actually
It's just a little boost to enhance what people are already doing.
This
in
is why
life.
it's called body sculpting.
Yeah.
It's not weight loss. Even though you can actually have some weight reduction, it is not for weight loss. It is actually for sculpting. And you cannot go eat French fries and 3 times a day.
It's not a magic
burger.
bullet.
No, it's not. And expect to have a magical result from this. And depending on your BMI, you have to do so many sessions to see the results.
Got it.
Makes sense.
And tell me about your business here. And again, we're talking here with Dr. Christopher Choi, and you're at the Concierge Wellness Center here in Las Vegas. And I know you've really been kind of pushing to the forefront your aesthetics medicine service over the last few years. And I know we've had the pandemic, and people haven't been coming out and doing these things. But are you seeing just more interest, especially in the last year here at your office?
Oh, yes, because remember, human beings are social beings, and we've just been cooped up for so long.
Right.
And we're frustrated. We want to do something good for ourselves. So we want to treat ourselves to something. So the study has shown that non-surgical aesthetics is really on the uprise.
Right.
Whereas the surgical aesthetics, it really isn't as much. But because people don't want to go under the knife,
it's scary.
So they rather do something that is more natural, but they want to treat themselves and make themselves feel good.
Yeah.
And in fact, because during the pandemic, we're always looking at ourselves in the screen, right?
Right, right.
So we start to see, oh, I got that little
Yeah, the
wrinkle.
Zoom really magnifies
Yes.
everything.
And so they're all coming in and say, oh, doc, I'm seeing this. I'd like to get rid of this, and so on. So I think that's why it's been very, very popular.
Yeah. So what do people need to know? Obviously, if they're thinking about it or they've been thinking about it, maybe they've heard about you and your clinic, what you do when it comes to non-surgical aesthetics. What are some of the questions they need to kind of be thinking, asking themselves before they even come to you?
Well, one, what they can expect. Right? What are the you have. I mean, there are limitations with everything you do.
Right.
Surgeries versus non-surgeries. So you want to ask, what can I truly expect as a outcome, and what can I do to make the effect of the procedure last
Right.
as long as it's possible? Because you're investing a lot of money into it.
Of course, yeah.
And how do I take care of my skin? The skin is the largest organ system in our
Right.
bodies. So how do I take care of my skin? Whether I do the procedure or not, how do I take care of my skin? Those are some of the things. And what are some of the things that I need to avoid? And what do I need to do to prepare for myself for the procedure?
Yeah. And obviously getting the most information. And if they can call your office, they can get as much information. Do you have a complimentary consult? They can come in and talk with you?
Yes, we offer complimentary consult for everybody. And, we will go over what we can do and what they can expect. And whether they actually proceed with the procedures or not, I will give them a lot of tips on how to take care of their skin.
Yeah.
And even, in fact, how to eat
Yeah.
and exercise.
And what have you seen in the people who work here and live here in Las Vegas coming to you? Is it different from Southern California? What are you seeing as a difference of your patients here in Southern Nevada?
Oh, gosh. I've been in Vegas for so long.
Yeah.
Honest, I don't really remember much of California.
That's true. This is your home now,
Yes,
right? Yeah.
yes.
But more and more people are moving here from California, right?
Well, I mean, that's a testament to, what our community offers, right?
Yeah.
Why are they moving here? Because we are better. It is better for
Best place to live.
It's best place to live.
Yeah.
And when I first moved here, I have to tell this story. I was trying to make a phone call because I had to make a phone call to LA, and for some reason, I couldn't use my cell phone. So I went into a restaurant and asked them, "Hey, is there a payphone nearby?" They said, "Oh, just use this phone." They actually gave me the phone to use, and I told I'm calling LA. They said, "Oh, no problem."
Aww.
And I said, "Wow, you know what? This is actually still like a country, countryside."
Yeah.
And I said, "Wow, this is the kind of place I want to live in."
Yeah.
That was actually very, very memorable. I still remember that.
Stay with you.
Yes.
Yeah, and I think that's the kind of service and the kind of attention that you're giving your patients every day, right?
Yes, I mean, as soon as our patients walk in the door, we do our best to make sure that their experience is top notch.
Yeah.
And that our outcome is the best. My clinic I'm only as good as my staff, and truly, we have a phenomenal A team, and so they do their best to everything that they can to make sure the patient journey is the best.
Yeah, and you know what? And it's a testament to the work that you do and how long you've been here and how much you've been recognized by other doctors and your patients here in Southern Nevada as well. Any parting words, especially for other maybe young and upcoming medical professionals coming into town and wanting to make this a successful place to do their practice?
Las Vegas has so many people, and we still have a deficiency of physicians.
Yeah.
We don't have enough physicians. There is no reason to compete with each other. We should all work together. And because when we do that, I think the outcomes will be better. And, any young doctor who wants an advice on how to start their practice, just call me. I'll be happy to sit down with them and give them any help that I can. And just remember, we are here to actually take care of the patient. And that's the number one thing. Patient comes first. And, that's the oath we took. So always do no harm and, put patient first above anything else. If you do that, of course, you got to pay attention to your business and so on. But you have to put the patient care as top priority. And if you do that, everything else will work out.
Yeah, I love that. And you've obviously adjusted with the times and made it successful for you and your practice and expanding it to give other doctors an opportunity to grow as well.
Yeah.
Thank you. Thank you so much, Dr. Christopher Choi from Concierge Wellness Center, for joining us on the show today.
Thank you.
Thank you. And thank you, everybody, for watching and listening. And we'll see you on the next episode of the Entrepreneur Showcase Series. Have a great day.